up is a project I care a lot about because it's a topic of my PhD. And because I get to work with really cool people. Deveney Bazinet here, her full name is Deveney Email Machine Bazinet. And she's the manager of health system decarbonization and adaptation. And if we're on track with the 6 minutes today, it's because of her repeated emails to the whole team. So thank you so much, Deveney, for all the work you've done today. Deveney and Vivian started 7 weeks ago. And 7 weeks ago, we were not planning to do this conference. And Vivian is a project manager and technical lead for this project, so I will let them speak to it.
Awesome. Okay, hi everyone. A lot of pressure to be the ones to stay on time, so we'll jump right in. Vivian spoke a little bit to the Decarbonization and Action Program earlier today. It's the newest project of the coalition. It's focused on hospital decarbonization. And it's really about moving from that ideas and planning phase over to implementation. So our innovation partner for this, at the bottom here, is Mars Discovery District, and this work is made possible by the Peter Gilgan Foundation. They do incredible work in climate change, they do incredible work in healthcare, and then with our project working at the intersection of both. Vivian also highlighted this morning that there are 5 main components of this project. We're going to go through them quickly and then really focus on that last one there. So with our partner hospitals, we offer 2 things. So one of them is implementation support and technical expertise. So that's working directly with the teams, looking at, okay, how do we move to implementation? Where's the support needed? And then for things that we're working on together or things that have already been implemented, we want to help to amplify that. Case studies, videos, social media posts, all those things, because we know it can be really challenging, as we'll talk about, to know what's going on and what solutions are out there. The other thing that we're going to be putting together in the next number of weeks is a knowledge and implementation network. And so this is going to be a series of webinars and resources that's going to be really looking at what are best practices in implementation, right? So at the project level, at the organizational level, looking at all the enablers, how do we really get implementation going? The first year of our project is going to be focused on the GTHA with the goal of scaling, but of course anyone can join the kin and you'll hear more information about this in the coming weeks. The last piece here is really about, and it was talked about earlier, how can we be more of a voice for policy and funding and deep change in the broader ecosystem. So those are the 4 pieces, and then I'm going to pass it over to my colleague Vivian to talk about this last component here, which is the Solutions Atlas. And I'll just say, Karen, thank you so much for queuing us up so well with this. Where do you find solutions? Our Solutions Atlas.
Amazing. So let's talk about Atlas. We know that the best way to accelerate climate action is through all of you in the room, our change makers across the health system. And we also know that decarbonization is a big, big topic. And as we've heard, there's a lot to keep track of. So we want to help you save time and energy looking up climate solutions. We want to help you get clarity on what you should focus on and have all the data at the ready when you're ready to talk to your colleagues, leadership, and other stakeholders about your ideas. And that's why we're developing the Solution Atlas. And our goal is to streamline this fact-finding process for you and make all the solutions easily accessible. And we're very excited to share with you what the platform currently looks like. So when you get access to the landing page, you can explore the solutions by 2 different formats. There's a more detailed tile view where you can skim over the problem and solution descriptions, or a more condensed table view that lists the solutions with the key decision factors, like the type of solutions, whether it's mitigation or adaptation, what are the specialties, for example, primary care or nephrology, and the implementation status, whether the idea is more of a concept phase or widely adopted. And most importantly, the impact level, considering the emissions reduction potential as well as the financial implications. A big part of our work is consolidating this wealth of information out there for each of these solutions, and to design a solution profile to make it easier for you to access the key information. So let's see an example in more detail. Let's say you were really inspired by our speakers and wanted to support this fluorine phase out. You can click on the solution and you can find the headline figures on emission reduction potential. And you can see that it's a widely adopted intervention with an immediate return on investment. If you scroll down a bit further, you will find our estimates on the wider scale impact that could be achieved if the solution is implemented across Ontario and Canada. And so you can really use these figures to rally your green team. You can find also videos of implementation examples, case studies that we collected, and other useful information for really a variety of audience members. We cover co-benefits, common barriers, enablers, as well as practical guidebooks. So in a nutshell, we've designed this platform so that you can easily find and share ideas. We are consolidating information so that you can quickly prioritize by important factors. And we're working on identifying case studies and experts with experience on the ground so that you can connect across organizations and really join efforts to scale solutions. And to conclude, we want to make this atlas your go-to spot for climate solutions, and we want to hear from all of you. What would you like to see in atlas, and what data points would be useful to you? We are inviting all of you to sign up to our mailing list, scan the QR code, and you'll get early bird access, and we can't wait to hear your ideas and feedback.
So yes, one final plug for the Decarbonization and Action Program. I know we've talked to a lot of you already, but if we haven't, please reach out. I also just want to give a really quick shout out on our amplification side. We've been working with Sim and Hassan, dialysis technologists here, on a video on their incredible centralized system that is allowing St. Michael's to save, I think it's 70,000 liters of acid a year. So please find them, find out more, which is one of the examples of what we can do with this project. So thanks everyone.